ladies and gentlemen. Thank you very much. It's a great pleasure to be asked to come and speak here today. Yes, I was for many years an oncology nurse, giving chemotherapy, running oncology clinics, etc. And I began a very interesting journey into a more integrative path and integrative way of working. I lay the blame for that purely and squarely at the feet of patients I used to work with, who enlightened me and empowered me in finding out an awful lot more about what was going on and what was available. And at that time I was running oncology clinics, very happily doing my job, going home at the end of the day, and it's led me now to 13 years of research and consultancy into looking at all the different ways that we can actually help ourselves against cancer. Looking back over those 13 years now, I kind of think I wish the patients sometimes hadn't empowered me quite so much. It was so much easier in those days. But the people that did empower me, and one lady in particular, Gillian, I very, very fondly remember, were people who had cancer, were certainly having chemotherapy, radiotherapy treatments for cancer, but they weren't prepared to leave it at that. They wanted to know an awful lot more about how they could help themselves. And Gillian, I remember, was a delightful lady, an absolute powerhouse. I was working in Nottingham at the time, and she lived in Nottingham, used to work in London, come home at weekends, and she'd come to us once every 3 weeks for chemotherapy, and she would come and she'd just burst through the chemotherapy room doors, and absolutely full of energy, full of life. And I used to look at her and think, my goodness, you know, she's just so incredibly well. And she had a diagnosis of bowel cancer with liver metastases, and at that time the prognosis was extremely poor. And she was certainly very advanced by the time she was diagnosed. And she frankly lived 4 years, and she lived 4 years well. And when I got to know her, and got to know what she was doing and find out how she was helping herself, she was in London, she was having intravenous vitamin C drips, she was having a very, very good nutritious diet, she was detoxing, she was looking after herself. None of this information was important to the oncologist I was working with at the time, because unfortunately he wouldn't have welcomed it very much. But I remember standing outside her door one day with him, and we're looking at a CT scan, and he's going, wow, this is fantastic, Patricia. It's my best ever patient. I've never had such a good result. I go, yeah, you're the man. Yeah, good stuff. So, but then, I find to think, you know, it's such a bizarre world that we've sort of devised in terms to deal with cancer. And I sometimes look at, I think one of the things that you'll learn from, you know, spending a few days looking at all the different speakers you get here, isn't it an incredibly bizarre and complicated world that we've developed to look at disease and getting people better? And, you know, it's interesting to look at how did we actually get to where we've got to. And, you know, in the past, in medicine, in healing, it was very much more of a hands-on approach. Very much more the person, it was about getting the person better, using herbs, using different compounds. And, you know, the original cholestoxins, one of the original fever therapies, sort of preceded chemotherapy as a method of dealing with cancer. That has recently become available now again, thank goodness. You know, for those of you who don't know, sort of chemotherapy came about with the First World War, when they gave mustard, you know, they used mustard gas on soldiers, and then noticed there was a change in the blood counts, and from there we evolved this method of using a poison in order to get rid of cancer out of the body. So we moved on, and we moved on to this very high-tech approach that we have at the present. And we're using very, very high-tech approaches, more new molecules, lots and lots of very high-tech things. And the thing that's just, you know, what is missing from this picture really, the thing that's missing from the picture is the person. The person is there, but, you know, like in that picture there, the person is there, you know, they're being towered over. It's you know, the person's part in dealing with cancer and healing and getting themselves better is actually a very, very passive one indeed. And when I was, certainly years ago, when people used to talk to me, or any of my colleagues indeed, about good nutrition, about complementary therapies, about using different things to help yourselves, you know, we used to laugh, quite frankly. I'm not shortly ashamed to say so, but, you know, we did. We thought people were very naive and very silly. And, you know, 13 years now, we've been getting more and more information about how natural compounds work, about how important good nutrition is. And, you know, let's sort of see what sort of impression that's made on the doctors. No, they're still laughing, I'm afraid, which is a bit of a shame. That's not quite true, to be fair. I'm getting more and more reports from clients every day that they're being told more about nutrition, that they're being, you know, the doctors are talking to them about vitamin D. There is a whole groundswell going on. I think the marvellous work that's done by an awful lot of practitioners is actually starting to make an impact now. What we really need to do is to get that momentum going so that we move through onto proper integration. And, you know, is the idea that supporting the body and influencing the body's microenvironment during treatment and afterwards, and providing the building blocks of DNA, is such a really ridiculous idea? And, you know, is it that just to give cytotoxic drugs and do nothing else is really such a good idea? You know, it's a paradox that we're even sort of continually having to have these discussions because it seems blindingly obvious. I mean, one thing I've learned about cancer is nobody has the answers. I still think we're at a point, to be honest, ladies and gentlemen, where we hardly know what the questions are. There's, you know, we've made it such a very, very technical thing. And a lot of doctors are very supportive and very empathetic towards people who are being holistic and helping themselves. Some go to great efforts to do so. But sadly, we also still get some doctors who still undermine people's efforts. And because we haven't yet got to a point where we have an understanding by doctors of really what integration should be and what's available for integration, we're still getting people told, no, and I see this every day, don't do anything to support yourselves during chemotherapy, just have the chemotherapy. When it comes to post-chemotherapy, and you get this, as everyone says, this awful bit where, you know, treatment stops and you kind of drop off the edge, thinking, well, you know, how safe am I now from cancer coming back? You're given no information and no advice, and that is a complete nonsense because there is so much we know that is good clinically based evidence of what we can do to help ourselves, that just to leave people like that is complete nonsense. So, but hopefully we're moving on and things are changing, and what I want to do is look at what are we learning about cancer now and different ways of dealing with it, that we can bring this integrative process forward as a great process. And I think my personal view, the one thing that will bring about change in oncology in this country, because I would say I look at what goes off around the world, and I do have clients over in lots of different countries, and in Europe and America, as two contrasting areas where people integrate, we are actually getting left behind here. Our doctors are getting left behind in not embracing that there's more that can be done and that we can bring different people in. So what are we learning about cancer? Well, what's been really, and I'll go over this sort of quite quickly because it's been, you know, most of these themes have been touched on quite a bit during the course. We started to learn, we've always known that cytotoxic drugs are cytotoxic and very damaging to the body's environment. And we started to get an idea that cancer cells, where they fail, they use advanced communication systems to enslave the normal cells. So cancer is a very, very complex and complicated process. And what's been observed is that they cooperate to elude the chemotherapy drugs, much like bacteria. And they communicate and they act as a team. So they resist attacks from cytotoxics. And some cancers appear to sense when chemotherapy drugs are present. And that causes the cells to switch into a dormant state, so they evolve it. Other cancer cells will actually develop proton pumps, which literally pump the chemotherapy out as soon as it goes in. So there's a lot that we've got to deal with in the body to try and help chemotherapy to work. And many cancer cells in a tumour can have many different variations. So some can harbour mutations, so they can withstand the toxic assault. And if that happens, then the potential for it coming back, if all you do is have chemotherapy and leave it at that, is actually very high. And as I said, even if you kill 99.9% of the cells, you're still left with a ton of cells which can start to grow. But that is not a negative message, because that is actually the area that you can actually do a tremendous amount for yourself with if you've got cancer. They say that giving cytotoxic drugs to resistant cancer cells is a bit like shouting very loudly at somebody who doesn't understand English. It's very frustrating and it doesn't actually lead you very far. And you look at first-line chemotherapy tends to have the greatest effect with the less likelihood of actual recurrence. And looking at these figures for 2005 for breast cancer, and as you'll see, in the first line of treatment, you'll get a 60% response. That still means 40% of people who have the chemotherapy won't respond, unfortunately, but 60% with chemotherapy is actually quite a high figure. And this is where it starts to get very difficult for oncologists, is that once you get into, if it recurs, you get to second line treatment, you got down to 30%. And then you're getting into sort of stage 4 metastatic, you're giving chemotherapy, you're getting around a 15% response, which is not a very good response. And that response doesn't even mean that the cancer is going to go away completely. You probably get some tumor shrinkage. It's more likely a symptom control situation. So, and then that means, second and third line, you've got 70, 85% of people who will be given that chemotherapy. Perhaps they won't respond at all. And that, I'm not anti anything that works against cancer, but I always think there has to be a very, very good argument for it. And when you're looking at those sorts of figures and that kind of process that's going on for somebody, you've got to ask yourself, shouldn't we be looking more diversely at how we can help people? And when people look at this and sort of say, well, perhaps chemotherapy is not the right choice for me. Perhaps I do want to look at a more integrated program to support myself. And then we had the news this year. So this is a previous one. We began to get some idea of what actually happened when you gave chemotherapy, what the DNA damage was. What is the process that takes place whereby the body can recover or not recover from chemotherapy and can actually heal itself? And what they found at the Washington University was that mutations in acute myeloid leukemia, the relapse, are different to those present in the primary tumour. And so there's a telltale signature of DNA damage. What that simply means is that the damage from the chemotherapy has caused the cancer to recur in the future. And then earlier this year, we have what was labelled the very inconvenient truth. Evidence coming through that chemotherapy is so damaging to the healthy cells surrounding a tumour that it changes their DNA, causes fibroblasts, and these are actually producing a molecule that actually encourages, this was prostate cancers, they found it with breast cancer as well, to grow and invade neighbouring cells. So a pretty awful paradox that the actual drugs that we're using to get rid of the malignant cells is actually encouraging metastases to develop. And they found this in samples of prostate, prostate, and ovarian cancer. So what does that mean for people with cancer? Well, and does that mean that everybody who has cancer shouldn't have chemotherapy? No, absolutely not, it doesn't. That would be a very simplistic view of that piece of information. What it tells us is that we're actually identifying the ways in which chemotherapy is perhaps causing nearly as many, causing more problems than it's solving, or causing nearly as many. But we had the response from Cancer Research UK to this, which I personally found enormously disappointing. And it says, Cancer Research UK's response was, it doesn't show us that chemotherapy makes cancer harder to beat. I agree. It gives an insight into the way that the body can develop resistance, and that's good because we do need that resistance. It doesn't tell us anything new about chemotherapy treatments. We already know that cancer responds to some chemos and not. And there isn't one answer to every individual type of cancer. Some cancers you'll get a very good response from chemo. Some cancers you have to look at the situation and think, is it worth doing at all? And then the disappointing response from Cancer Research UK is this will lead the way to new drugs to solve this. So that was their response. So you're looking at the extracellular matrix of the body being so damaged that it then encourages cancer cells to grow. Well, what is the extracellular matrix of the body? It's the normal cells. It's the person. The person's normal cellular activity is so damaged. So how do we solve that? We don't run off and spend 10 years developing a drug to do it. That was a very disappointing bit by them. That what they couldn't see is that the answers are here already. That actually, as everybody who works sort of in the complementary world knows, all the work that's being done is actually to support the cellular matrix of the body and to help to maintain that. So it shows us that depending on the position and the aggressiveness of tumours, it's possible that chemo makes it worse. And that we need to have much more comprehensive ways of dealing with it. Now, you know, that I think could be turned into a very positive thing, because doesn't that mean that actually what it means is that the person involved with the cancer, we've always been very, very tumour focused. I remember being in oncology, all we ever talked about was the tumour, as if it existed in isolation to the person. And actually what this means is the person, the microenvironment of the body, the person, everything that that person does becomes very, very important. I think it becomes more important than the chemotherapy itself. And in effect, that if that was brought into play in a much more dynamic way, then perhaps we could actually do what takes place in Europe to some degree, and beginning to in America, is that we can look at using lesser doses of chemotherapy. We don't necessarily have to do away with them at all. One of the slightly things about, you know, you'll hear a lot about how to balance the body, how to support it. The thing with cancer is that you need time to do that. And that's what happened. That's, you know, a lot of the work I do with the Yes to Life charity and with Cancer Options is helping people look at this situation and judging how aggressive it is. Do you perhaps need chemotherapy to knock things on the head, to give you an opportunity to rebuild the body and get things back on track? And that's where you need individual analysis. There is far too many sort of broad statements made about how somebody can deal with chemotherapy. And as Julian said, you do need the coming together of the two. You need someone to, you know, when everyone's given any advice about anything to do with cancer and health, we need to make sure that they're kept safe. That is the, you know, the most foremost part of anything that we do. So this current situation, you know, where does that leave people with cancer? If you've got diagnosed with cancer and you're deciding, what do I do? Do I go down a completely sort of detoxification vegetarian route? You know, do I go for the very high-tech stuff? Do I perhaps go for clinical trials? Those are very, very complicated questions to answer. And generally, you know, people, when they get onto the internet and try and get information about all these things, it can be pretty damned overwhelming. But really, what we need to do is to work towards a process by which people are given full information, or people who want to. Some, you know, not everybody wants to be able to take an active part in the cancer, fair enough, but those who do, where they are being given a detailed assessment of the potential aggressiveness and potential results of their cancer treatment, where they can start to devise their own program in terms of where they put the weight of evidence on how they want to deal with it. So at the moment, we've got this situation where, because we don't integrate well in this country, because complementary and orthodox sit in two different fields and throw stones at each other, because of that, and people, I think people instinctively knows what heals them. You know, I always think a large part of the work done by any good practitioner is to enable somebody to become their own healer and enable them to learn enough about themselves. I think there are no experts when it comes to cancer. What you want to do is turn the person with cancer into an expert. And all the people I see who do incredibly well against cancer, that's what they're doing. They're becoming their own expert. We intuitively, I think, as human beings, we know what heals us. We're not daft. Unfortunately, orthodox medicine has kind of eradicated from the picture all the natural stuff that we know will instinctively heal us and downgraded it in importance. And I think what we really need is a very large upgrade in the importance of that, so it can sit alongside anything that the orthodox has got. And also what we need to do is to stop this ridiculous method we have of sort of saying, okay, we've got this compound, look, in 3 months it shrunk the tumour by such and such. Whoopie-doo. What's that in the larger picture? If it's damaging the cellular matrix, what is that in the larger picture? How much is that going to achieve for somebody? And also sort of saying, yeah, well, I've got cyclophosphamide, I've got turmeric. Oh, this is going to shrink the tumour faster than that one, so this one's better. That's not the picture at all. That's not the picture by any means. When you put together a good integrative program, you put together layer upon layer of nutrition, of oxygenating, of exercise, of everything, it becomes greater than some of its parts. It becomes, it becomes greater than cisplatin and cyclophosphamide. And combining the two, then that's where you get people getting the greatest results. So why does cancer recur? Well, it recurs because, as I say, the microenvironment encourages metastases. Stem cells are left untouched by chemotherapy, so they can just start up again. The immune system is very, very suppressed following treatment. The previous speaker spoke about stagnancy in the body. I completely agree. I used to observe the person who came out the other side of the chemotherapy treatment was not the person that went into it. And liver toxicity, stagnancy, they say, oh, don't have a massage, don't touch the body almost, because, in case you, cancer's very, very adept to, it'll get around the body if it wants to. The lymph system flows, so why wouldn't you have a massage? Why shouldn't you exercise? Stagnancy is a tremendous thing, and certainly I did palliative care for a while, and as the lady rightly said, the liver. I saw an awful lot of people die from cancer, and I don't know what was going off, and sometimes, you'd be in oncology clinics, you put the scans up and you go, oh, great, tumours aren't doing too bad, they've shrunk a bit, and you look down at the person and think, uh-oh, that's not good. And liver toxicity, just the body, and the more symptoms they got, the more drugs we gave. And so the whole thing just became a self-perpetuating sort of cesspit of toxicity, which was just appalling. The toxic assault continues if the person has got a lot of toxic elements going off in the body. If that doesn't change, then it will continue. Hormones I'm going to look at a bit later, because hormones are very, very important with most cancers. The body's environment not changing if you've had a body environment to start with, and that's contributed to the person getting cancer in terms of diet, lack of exercise, etc. That's got to change. It's secondary to chemo and radiotherapy. The inflammatory cascade goes unchecked. Inflammation is a precursor of most chronic diseases. If you eradicate inflammation in the body, then you'll prevent an awful lot of diseases. And any underlying viral and malabsorption absorption issues are not corrected. And again, and some of these, it's chicken and egg. So some things will be caused by chemotherapy, some things will be there before, but vitally important. If you're going to give yourself a good chance against cancer, you've got to get a good level playing field whether you can do that. There's some interesting work by Dr. Mina Bissell. And she's a director of life sciences at the Lawrence Berkeley National Lab in California. And this is available on YouTube. It's a really interesting piece on her work looking at cancer involving an interaction between the rogue cells and the surrounding tissue. And again, what this emphasizes is the importance of the person's body, in that we're not just treating a tumor. The whole body has to be treated, and there's this interaction going on between the two, that if you can influence that, if you influence that and you influence it well, then you can have a very, very direct impact on how well you survive cancer. And this means, and I'll put this as concisely as possible, that surrounding cells and the surrounding extracellular matrix interact to shape the cancer cell's behavior, such as the polarity, prefiguration, and proliferation. And the microenvironment is actually shown to actually regulate gene expression. So the microenvironment, the environment surrounding the cancer cell, actually has a direct effect on gene expression. So it may actually have more to do with the state of the cancer cells themselves. The cancer cells are just sort of going slightly crazy. And she's got some very good filming that she's done of different cancer cells, of where she takes them from the environment in which they're thriving and put them in a different environment, and they return to normal. So what she's saying is that cancer cells can't turn into a lethal tumour without the cooperation of the cells surrounding it. And it's not just the other surrounding cells, but the environment and the pH and nutrient levels being supplied by the blood. And Dr. Smithers, who was then at the Royal Marsden, argued that cancer is not a disease caused by a rogue cell that divides and multiplies, but until it destroys a host. He says cancer is no more a disease of cells than a traffic jam is the disease of cars. And a lifetime of studying the internal combustion engine would no more help anyone understand our traffic problems. And their theory that actually the body actually influences the growth of tumours is completely compatible with some of the work that's done in Europe, whereby they use lower doses of chemotherapy, and it's completely compatible with some of the newer targeted therapies that we have for dealing with cancer. And some of the greatest successes I see in clients and with the Yes to Life clients are in people who are fortunately being able to access some of the newer targeted therapies and being able to support the body with that, so where the immune suppression isn't being as bad as it is with others. So what mainstream researchers are failing to find is that we can approach cancer from a completely different and opposite angle to chemotherapy. So if we can imprison the cancer in a solid wall of cells, then it's going to be weakened to a point. And I see a lot of people who perhaps haven't in pure oncology terms got rid of all the cancer. And they may still be there. They may have cells circulating, they may have tumours. But they've got it, the body is playing a part. It's got it very well under control. And it may not come back and cause them problems again in the future. And so you turn cancer into a chronic disease, a bit like you do with heart disease and diabetes. So what are the aims of a good integrative program? Is always to support the body during treatment if the person chooses to have treatment. It's also to offer somebody an alternative if they decide not to. It's very, very individual on whether someone should choose chemotherapy or not. We really need to be providing people an awful lot more information to enable them to make that decision. Some people are adamantly against chemotherapy, and perhaps it wouldn't be a bad idea if they actually use some, and some people are not. And so if some people have got the top cancers, like pancreatic cancer, some of the lung cancers, etc., where they respond very, very poorly to chemotherapy, and the chances of it causing more harm than good are quite high, surely we should offer them a much more integrative process in which to help themselves. And you can enhance the effectiveness of treatment. There's a lot of very good research showing which compounds will actually enable chemotherapy to work better. You reduce the levels of inflammation, prevent angiogenesis, stop the blood supply coming to the cancer cells, and maximise absorption of nutrients from the food. And as everyone else has said today, alkalise the body and increase oxygen as much as possible. Just going to look next at some of the latest sort of research that's coming through to support all this. The University of Manchester recently, sorry, I haven't put the date on that, it was a couple of months ago, diet and lifestyle may much more significant role in a person's ability to respond favourably to cancer therapies. So the nutrients in the environment are critical to the fitness of the cells that carry genetic mutations carried by disease. And this is why do some people survive cancer and some don't? Why do people with the same disease and same sort of level and stage do better than others? And then you get the element of survivorship. Once you've come through chemotherapy, this recent study showed more than 1/3 of cancer survivors in the United States have physical or mental problems that puts their overall health in jeopardy. Everybody who comes through those sorts of treatments will unfortunately have some lasting ongoing effects, but this actually is to an extent where it does actually prevent their overall health from returning to normal. And the main things that people suffer from once they've had treatment is fatigue, pain, depression, neuropathy, sleep and cognitive problems, post-traumatic stress disorder, and psychosocial and sexual problems. Now, not to say that everything about the complementary world is good and that everybody's a good practitioner. Not by any means. I think that's very important to say that. I've got to know an awful lot of people in the complementary world, and there are some good, there are some bad, and there are some I could sit and tell you stories about for about the next 5 hours that are just, ridiculous. Some of the things that people can come out with, and that's a very important thing. And I think the Yes to Life charity work very hard to make sure that, you know, the quality of information that people get and the people that are directed to, the quality of that practitioner is very, very important. And the negative aspects that I found is lack of knowledge of disease process. You know, you see this on the internet where people, you know, anyone can access and put information on. You can often read something that they've got no idea of the actual disease process of cancer and what it entails. So this is where you get your nonsense with your, you know, your super cures coming across where, you know, oh, cancer's, you know, people with cancer are low in magnesium, correct magnesium, and that's all it takes. You know, we all know that's a nonsense. One thing I would say is, said at the beginning, when I was in oncology, one of the things that drove me to set up Cancer Options was, I don't think that people with cancer, and this is a thing that comes from the oncology a little bit, that you get sometimes, that if people are looking at natural and integrated ways of doing things, they're not unintelligent, they're not naive, they're not stupid, they just need good information. And, you know, it's too easy for the orthodox world to patronisingly sort of, oh, you can do a bit of a diet if you like and see how you get on. They need to take this much more seriously. The other negative aspects is one approach for everybody with cancer. I don't believe in that at all. There's two things there. One approach for everybody with cancer is almost like treating them. What we're aiming to do is for individuals to be able to evaluate and assess things themselves and choose their own paths with very good guidance. And there isn't one diet for everybody with cancer, there isn't one approach, but we do have a large amount of different things that are available, that as long as the advice is safe and efficient, then, you know, that's fine. People will be able to choose safely. Evangelical zeal is something that can be overused in a way that, and you see paradoxes between what happens in the orthodox world happens in the complementary world, where evangelical zeal and being negative about other approaches. Nobody should tell you, anybody with cancer, that they absolutely know exactly what's going to sort it out for them. They have the answers. All you need to do is this. Everyone should be opened up to many, many different ways of doing things and be advised very well about what they're getting. And unrealistic expectations not discouraged. That's always a very sad element. There are going to be many, many occasions where the most you can expect from complementary approach is perhaps that it's supportive to the body and it will make the disease process more bearable, you know, in the fulfillment of someone's life, and that's being realistic. I think, you know, anybody who gives someone false expectations about what can be achieved is a very poor practitioner indeed. So, just to compare the two, in terms of what will often and how you could bring the two together, you know, let's take from diagnosis. When someone's in a very great state of shock, they're feeling helpless, they're very disempowered, and we're going through things like CT and MRI scans, biopsy, surgery. On the orthodox side, and they do obviously now get offered a lot of things like counselling, aromatherapy, acupuncture. What the integrative side could bring to that is there's antioxidant formulations that may prevent DNA damage being researched by doctors in Europe, so prevent the damage done by CT and MRI scans. Biopsies are known to release cancer cells into the system, so you can increase the natural killer cell activity by things like mTARK, beta-glucans, MGN3 Biobram, which can be prescribed by doctors if they've got a very nice doctor who'll do that. You can get practitioner packs for them. Nutrition, increasing surgery and wound healing. Hyperbaric oxygen therapy is something we use a tremendous amount. Oxygen I'm going to talk about quite a lot, but hyperbaric is particularly good when people have had surgery for wound healing. And endocrine support to help people with the stress. And the treatment aims of orthodox, this is just going over what I've already said actually, orthodox is trying to remove as many cells as possible. It's a very passive process, and the weakness is that it's toxic. The integrative, we're trying to find out exactly, support the body, find out what's going on underneath, what's the onset of disease imbalance, and support the patient psychologically and emotionally. The orthodox side doesn't offer anything else, but the integrative side, prevent recurrence through the use of natural anti-cancer compounds. I think it's almost more important what you do once you finish chemotherapy than what you've done having the chemotherapy. Chemotherapy, radiotherapy treatments are very much the first step. And once that finishes, then the real work takes place, because then you're going to heal the person and heal the body. The big weakness of the integrative approach at the moment is that it's unsupported by the orthodox world, and this horrible, messy situation we've got at the minute where we're trying to move things forward. For somebody with cancer, that can be pretty isolating and potentially stressful. And sometimes, you know, it's the isolation and stress of trying to work is too difficult for them. So there's an awful lot of very, very good groups, organisations that will help people who want to integrate nowadays, and that's only going to increase. So we need to make sure people find their way to that. It's self-funded, which is always a big issue. Everything costs money, unfortunately. And as I say, you can get an exposure to poor practitioners. So, what emerging knowledge can we consider in our strategies for treatment? The orthodox treatments that are making a big difference are mainly the ablation techniques, things like cyberknife, nanoknife, intraarterial chemotherapy, laser ablation, Certex. And these are really elements where you actually target the cancer themselves. You're not putting stuff into the body systemically, so it's not going around every cell in the body. And all these things, if you can get rid of a tumour or shrink it, or just blast it to pieces with any of these treatments, that is generally quite a good thing to do to reduce the tumour load and enable the person to get back on. We have a bit of a thing in this country that I don't see in Europe so much, whereby if somebody has systemic chemotherapy, secondary cancer, they have cancer in more than one place, and you know that they've got a tumour that is stuck, tumours in the liver or stuck near the pancreas or somewhere where an ablation technique could perhaps reduce that tumour load and get rid of it. There's a great reluctance in this country for doctors to actually treat them. They just want to use the systemic chemotherapy all the time. And this is an area I see that we could move forward a great deal on. In Europe, they will target individual tumours much more so than we do. I was very pleased to see last week intraarterial chemotherapy in the liver. I've been sending people to Germany for many years to Professor Vogel, who does a marvellous job over there. He's only doing the one area, but it enables us to do a lot of work on the rest of the body. And I saw in the paper last week that that may now be starting in Southampton, so that's very, very pleasing indeed. The difficulty with getting these techniques is, first of all, getting to know about them, and then getting your oncologist to support and refer people for them. The other things that make a big difference in the orthodox world, obviously early detection makes all the difference. On the drug side, PARP inhibitors are something that was as a drug that's coming along. I was reading some research from America the other day on it, and PARP inhibitors were originally devised for tumours that have the genetic BRCA gene. They're now opening the studies up to lots of other cancers and actually look like they make a significant difference. Trastuzumab emastine, which is a combination of Herceptin and another drug. The early result studies on those are absolutely amazing. I think some of the best results I've seen so far. It's early yet, hopefully that will continue with that, but that's going to be a very good drug. Abiraterone's made a big advance in prostate cancer, and several more new things are being licensed in America at the moment. So we've got this movement coming through of these new treatments, and that's great. That's very good. The only problem with it is we have what Professor Carol Sikora called the perfect storm. We've got a massively increasing number of people being diagnosed with cancer, and the projected figures are frightening for how many people by 2020, 2030 are going to be diagnosed with cancer. Our drug companies are coming up with these drugs, which is lovely, but they're so expensive, and they're already being limited. So when they come to nicely their cost and effective bit, so many of them are not being used. And so it's what Professor Carol Sikora called the perfect storm. Loads of people with cancer, techniques we can't use and we can't afford them. So wouldn't you think that actually it makes sense to look at an integrative program that could actually effectively support these, and we can use these to help get the cancer under control while the person helps themselves to get the cancer controlled and get themselves better? That would actually be a lot more cost effective. I think it would. Some of the other things that have come through recently, aspirin, and you can get natural natural derivatives of aspirin, has been shown to reduce disease-specific mortality more than 50%. And there's a lot of studies showing that aspirin's well worth considering, or the more natural alternative, I would say. On hypoxia, it's a big thing. Oxygen and cancer. It's one of the most underutilized methods and one of the most under-researched to date, but there's a lot of research coming through now. Cancer's low in oxygen, 3 times more resistant to radiotherapy. So restore the oxygen levels and the tumours become more sensitive to treatment. As I say, we encourage people to very much use hyperbaric oxygen chambers during treatment, during chemotherapy, during or after post-radiotherapy, post-surgery. Or get an oxygen concentrator at home and do some exercise while they're using oxygen a couple of times a day, half an hour, and really get tons of oxygen flowing around the body. The body will produce sodium bicarbonate naturally that way and alkalize. And more, I won't go through that because it's a bit boring actually. More work on hyperbaric enhancers, radiotherapy and chemotherapy. Sadly, I think about 6 out of 10 doctors still tell my clients that, that actually oxygen causes cancer to grow and spread. That research is very, very out of date on that now. And indeed, low oxygen levels, this is a recent study, could actually drive cancer cell growth. So low oxygen levels in a cell interrupt the activity, oxidative process. So cancer cells simply alter the way that they metabolize glucose and oxygen. We know this, and that's why people shouldn't ever eat sugar when they've got cancer. But this is a very interesting hypothesis that when the oxygen levels dip dangerously low, and angiogenesis starts to occur where the cancer cells start to die, the process of creating new blood vessels begins. The new blood vessels provides oxygen. And what actually happens is that it can actually lead the cancer to go searching for oxygen. I'm not saying this is completely true, this is a hypothesis, but it's a very, very, very interesting one that was published recently in the Journal of Cancer Research. But the simple answer to that, what we're trying to do today obviously is show that there is actually good research behind all these things. What it means is that getting oxygen to the body, we know, is a very good thing to do. Sodium bicarbonate. Sodium bicarbonate is a very good way of alkalizing the body. There's been some interesting work done on that. And now the National Cancer Institute in America has granted $2 million. It's a bit of a small grant for them actually. I think that's the tail end of their budgets. But they have actually started to put stuff into sodium bicarbonate. Vitamin C, which has always been one of the mainstays of natural compounds that we use to help the body defeat cancer. It's recently been shown that it actually reduces inflammation in the body as well. And modulation of inflammation by intravenous vitamin C correlated completely with decreases in tumour marker levels. So potential for being a very good natural chemotherapy. Tumours are less able to accumulate vitamin C compared with normal tissues, and this relates to the ability of the tumours to grow. And low vitamin C levels allows cancer cells to thrive in conditions of stress, and that's from the Cancer Research Journal. This is sorry, a bit gross. Sorry about that. This is a stomach tumour, and when you look at this, you can see the elements that you can see from here are when somebody has cancer and we just throw cytotoxic at it, what's going to happen? Well, as you can see, there's an awful lot, I don't know how clear that comes out across there, an awful lot of very dead, sort of necrotic, horrible tissue there. All that stuff will be giving off lots and lots of toxins into the body, all going off into the blood, making the person feel really unwell, all toxins that the liver's got to deal with. You can see the more normal cells up at the top there surrounding that tissue, but again, massive levels of inflammation, all this necrotic, no oxygen in there whatsoever, all those cells are dead, and then tons and tons of inflammation all around that tumour. So to just do a process whereby you throw drugs in and not support the body, again, seems ridiculous. So exercise. When people with cancer, there's so much research coming through on exercise now. It's everybody should be given a good program for this. When they exercise for several weeks after they finish chemotherapy, their immune system actually remodels itself to become more effective, which is fantastic. So potentially fending off further incidents of cancer. And there's been lots and lots of studies showing that people need to start exercise as soon as they finish during chemotherapy and soon afterwards. Again, what we need to do though is leave people in a state where they're able to do that. I'm sure if anybody here who's had chemotherapy, they're probably thinking, yeah, that's a great idea, lots of exercise. Did you see me when I was on chemotherapy? You know, it's certainly not easy. I do appreciate that. Luteolol is a flavonoid commonly found in fruit and veg, and this has been shown in lab conditions, but a good indicator, to be anti-inflammatory, antioxidant and anti-cancer. And new research, it's able to inhibit the activity of cell signaling pathways important for the growth of cancer in colon cancer cells. So these things do actually, you know, it's not just a case of supporting the body, these things can actually have a very, very direct effect on the signaling processes of cancer cells. Soy, always, gosh, the old soy controversy has gone backwards and forwards about whether soy is good, bad or indifferent, and what soy is good. But this is where you get more individualized information. Soy can reduce PSA by reduction in the expression of the androgen receptor and several other mechanisms as well, and that was quite a significant reduction in PSA levels. Grapeseed extract kills head and neck cancer cells and leaves healthy cells unharmed. And vitamin D. We all know vitamin D, which is not a vitamin at all, it's actually a steroid. You know, most doctors in America now, oncologists will actually prescribe vitamin D when you're diagnosed with cancer because they appreciate the significance of how important it is. Over here, there's been a much, much greater rising awareness amongst our doctors that vitamin D is important. And as Julian Kenyon said, we're not overwhelmed with the sufficiency of sunshine in this country. So we've known it improves outcomes for a long, long time, but how does it do it? And this research shows us it actually inhibits inflammation. That if you are low in vitamin D, you will not stop the inflammatory cascade taking through the body. So the chemical cascade that takes place with lots of inflammatory signaling that goes on as cancer starts to develop in a body, you will not stop that. That will go on and grow. This is how vitamin D helps people prevent getting cancer. And it outlines a chain of events from the binding of the DNA through the signaling pathway to the reduction in proteins known to trigger inflammation. So that's probably cleverer than most chemotherapies I've seen, to be perfectly frank. But and it appears that we actually have a tumour suppressor in our intestinal tract. It's been previously identified that it plays a key role in strengthening the intestinal barrier. But without that receptor, the barrier weakens, and that leaky gut, and I remember when I first set foot in this sort of complementary world many years ago, I was talking to a doctor in London, he was talking about leaky gut, and I thought it was all very odd. Who would have known that, you know, all these years later, you've got adverts on the TV every day for drinking yogurts to help prevent it. So leaky gut may be the root of some cancers forming the rest of the body. Any of the doctors who've worked in integrative medicine over the years will go, yeah, we've been saying that for years, and quite right too. Cruciferous vegetables, as you all know, very good. Here's a study to support it, a very, very big one. 5,000 women for 5 years after they're diagnosed with breast cancer. As consumption increased, the chance of dying fell by between 22 and 62%. That's phenomenal, just from eating your broccoli. And from all causes, again, between 27 and 62%. Well, then come on to the more side of toxicity. Cadmium has been linked to a very rapid breast cancer cell growth. We've got, as has been said time and again, we've got a very, very toxic environment, and breast cancer cells become more aggressive the longer they're exposed to small concentrations of cadmium. So a heavy metal which is found in cosmetics, food, water and air particles. So we're exposed on lower levels of this on a very daily on a daily basis, and cadmium will actually enable breast cancer cells to become much more aggressive than they are. So hormone metabolization is very, very important. Many cancers are, we now know, are actually encouraged to grow by hormones. The knowledge on this has increased tremendously over the years, that we now know that not only breast cancers and prostate cancers can be influenced by hormone growth, and there are hormone receptors, estrogen receptors and other hormone receptors on the cells. We now know this to be true for most cells in the body. And we do live in a very, very hormonally rich, toxic environment. And that if you've got any of the types of cancer that we now know that melanomas, we now know that brain tumours, lung cancers, ovarian, and I strongly suspect most of them will have some influence, will be proven at some point to have some influence, that may be a basic driver of the cancer. So again, along with nutrition, paying attention to hormone metabolization is very important. Estrogen is maybe resorbed into the gut, so the health of the gut is vitally important. It undergoes deconjugation in the liver, so looking after the liver is important. I know we're coming back over the same things again, that you keep hearing, look after your gut, look after your liver, but it's absolutely true. It's absolutely true, and we know this to be so. And our exposure to synthetic estrogen is now very, very widespread. I believe there are some, Robert will tell me if I'm wrong, there are some laws going through the EU, I think, on plastics and packaging at the moment, which will hopefully change that and make those a little bit better. But at the moment, everything comes wrapped in, we live in a plastic world completely. We've got fish that come from polluted water. And the contraceptive pills and HRT have, in my view, absolutely fueled the growth of breast and prostate cancer in this country. We have amongst the highest levels in Europe, and there is a reason for that. Estrogen is produced by the fat cells, so we need to reduce that. And when estrogen is high, it increases immune activity, including inflammation. So estrogen causes inflammation in the body. And when it's not broken down, then that is when we develop toxic estrogens in the body. Methylation is the principal way in which estrogen is deactivated. And for that reason, folic acid is essential. I disagree with, I think, Julian Kenyon's a bit simplistic comment that you don't need vitamins and minerals. I agree that if you're taking, you get all your vitamins and minerals from food, excellent, but there are certain areas where we can specifically target where people need more things. B vitamins for methylation are, can be absolutely essential. And we can't always guarantee that we're getting enough through the food. Dairy, I don't know if this has been touched on yet, but dairy is a very, very major source of estrogens and antibiotics. There's 59 hormones found in both the regular and the organic milk, including all the steroid and thyroid hormones. So remember, most cows are extremely stressed. They certainly are. The cow's milk contains a considerable amount of sex hormones, and dairy accounts for 60 to 80% of estrogens consumed, because what they do is, unfortunately, they get a cow when it calves, and when it's still lactating, they start milking it, and that milk is designed for the calf. It's full of insulin growth factors. It's designed to make a tiny calf grow into a great big cow. It's not designed for us to consume at all, but it means, from the dairy farmer's point of view, that they can then produce 50 gallons of milk instead of 5 per day. And you see the cows, and up in Derbyshire walking recently, and we saw these cows in the field. They're absolutely skeletal. They've got spines sticking out. They've got the bones sticking out through the backs of their hips. You could see every single rib. The only thing on them that wasn't absolutely skeletal was the size of the udder full of milk, which is absolutely enormous. And that's because estrogen stays in saturated fats, and so that all those hormones go into the saturated fat, goes into the milk, and goes out for human beings to consume, which is disgraceful. And then we have the problem with our water supply. Estradiol is a very, very potent chemical. There's several elements of estrogens when you look at a hormone profile, estradiol being the most toxic and the most likely to enable the proliferation of breast cancer cells. Now, every year, more than 2.5 million women take birth control pills in the UK, and estradiol is excreted out and washed into the sewage systems. Research has found 80% have noticeable levels of estradiol in the water. Now, in the paper a few months ago, I found it absolutely bizarre. I was sat there on a Sunday morning reading this argument, And we've gone on for years now saying this, you know, we do have the highest rates of breast and prostate cancer, plus other hormonal cancers. You know, we are the highest in Europe, we're amongst the highest in the world, and a lot of it is can be influenced by estrogen. So what do we have? We have water that's absolutely full of this toxic estradiol. And I was sat reading the paper, and there was this argument going on, and it said the water companies were saying, we know the water's full of estradiol. Absolutely. It's going to cost £6 million per water plant for us to take that out. And we don't think we should, because the drug companies put it in there in the first place, because basically women take the pill, they take HRT, pees it out into the water, along with all the other, one would say, antidepressants, any other drugs that are being taken, forms this lovely cocktail of stuff that is actually not filtered out. And so, we know it's not filtered out, but we don't think we should pay for it, they should. And of course, the drug companies are saying, no, we're not going to pay for it, you should. So what happens? We have this complete standoff, and we're giving our kids toxic water to drink. It's an absolute disgrace. Why someone's not making an absolute, someone's not taking this through Parliament and getting it sorted out, I don't know. And interestingly, women with hormone levels in the highest 25% of estradiol, testosterone, and sulfite have a 50 to 100%, 107% greater chance of developing breast cancer compared to women in the lowest 25%. So, and there's, when oncology says we don't know why all these women are getting breast cancer, yes, we do. Of course we do. Look what's happening. So anybody who's got elevated levels of estradiol massively increases the person's chance of getting a hormone-related breast cancer. The incidence of hormone-related breast cancer in this country has increased by how many 100% in the last 50 years? Massive. So, it's a disgrace that this isn't sorted out, that people are being, A, they're being exposed to it, and B, they're being denied the knowledge to do something about it, because we can actually reduce our actual estrogen level. Women, forgive me for going on breast cancer, but there's most evidence for that, but it does touch all the other cancers as well. And when women develop breast cancer, and they are actually given a drug that stops them taking, stops the estrogen being uptaken by the cells, 50% of women stop taking tamoxifen early. And it's usually the younger ones that do. And the reason they do that is because of side effects. I've had women say to me that I'd rather have cancer come back than continue taking tamoxifen. Now, I would say, to be fair, my experience is that tamoxifen affects people massively, massively differently. Some people are fine on it, and that's great. But other women are not. And it's the same with hormone therapies for prostate cancer for gentlemen. And they suffer from things like joint pain, hot flashes, decreased libido, feeling bloated, all the other things that go off. And particularly depression and malfunctioning of the neurons in the brain. We have a lot of hormone receptors in the brain, and when you use hormone drugs, then that gets in the way. So that's a troubling thing, and it concerns me, because I think, well, if they're stopped taking tamoxifen, what else are they going to do? And this is actually, again, where integration can come in terribly well. Because if women are going to insist, what you don't want to do is anybody not do hormone therapy, because that's vital when you've got cancer. But if they're not going to do the orthodox one, they need to do a more natural one. And there's a lot of evidence show that things like indole-3 carbinol, eating lots of cruciferous vegetables, quercetin, sorting out all the hormone elements, the gut, the liver, etc., will provide somebody with a great deal of safety. And also, anybody who takes hormone therapy should do a hormone program to underlie it, because what happens when you stop taking tamoxifen, when you do your 5 years, has the body sorted itself out? Has the body now being able to actually metabolize estrogen down those pathways that it should do? How do you know? You don't. The only way you find out whether your body has actually altered its processes or not is if the cancer comes back or not. So it's very important that people are given the information and the knowledge that actually taking tamoxifen or taking Arimidex is only half the job, and that you're taking great risk if you just leave it at that and don't get things checked out to make sure that you're now safe when you stop taking it. Who chooses 5 years, 3 years? If you don't know what's happened to your body during that process, then that's not very good at all. So, you know, women take, you're given all sorts of estrogen therapies, and this is what the integrative side can add. Indole-3 carbonyl, DIM, gut, liver function, green tea, soy isoflavones, silica liquid, when we can get it, flax seeds, and importantly, hormone profiling. So you can actually do a urine test and be assessed to see just how your hormones are working. That is, you know, this is the power of integration. That is a much more safe way of dealing with hormone-related cancers. I'm just going to finish off really with my one of my pet subjects for cancer, because I used to lecture on this when I was in the NHS, and it's something that I feel very, very passionate about. And it's one of the reasons why I think there isn't any one approach for cancer, there isn't any one diet for cancer. We need to look at what's happening in individual cachexia. Cachexia is a metabolic syndrome. It's the sort of syndrome you get when you're diagnosed with cancer. It only happens with certain types of cancers. It can happen with lung, esophageal, stomach, pancreatic cancers, one or two others. And it's a metabolic syndrome. It occurs when the body goes into overdrive. It starts over-metabolizing protein. Now, when this happens, it can be, you know, the sort of scenario where you know someone's got cancer, and then you sort of see them about a couple of months later, you think, my God, the weight's dropped off them. And it's not just weight, they're shrinking. And everyone thinks, oh, that's because it's almost, you know, is increasing so much, it's almost eating them up. It's not. It's not. This is a very, very inflammatory process that takes place in the body. And it can be, it can also, you can get incidence of it to a degree following surgery, following chemo, following radiotherapy. And what basically happens is the body starts to over-metabolize about 3 times its normal rate. So there's not enough protein going in there, and the inflammation is extreme. So what is our orthodox approach to that at the moment? It says to eat a lot more ice cream, fats, Mars bars, just anything you can to get energy into the body. That's completely the wrong thing to do. That will just fuel the inflammation. It's really, that's poor, very poor advice indeed. What we need to do is to get enough protein in to stop that, and protein from vegetables, protein from lots of good food, to stop that process, to have enough protein to stop that breakdown taking place. We need to reduce the inflammation in the body. If you don't do that, cachexia will go unchecked, the person becomes very malabsorbed. It becomes lots of syndromes where they actually, the psychological symptoms that come with it are a bit like anorexia. They actually stop the person wanting to eat. So as soon as they see some food, they try a little bit and think, the brain just switches and goes, I'm full. You see this a lot with families where the families are trying desperately to sort of feed the person up, and the person's going, oh God, you know, I can't face it. That's cachexia, and it's actually a chemical reaction that's taken in the body. This can be turned around, but it won't be turned around if we continue to deal with it the way that the orthodox world deals with it at the moment, which is to tell people to eat rubbish. And we also know exactly which types of cancer this is likely to develop in. So people need to be informed that this is a potential problem that may occur. It's not related enormously to the amount of cancer in the body. It will increase as it escalates, but somebody with pancreatic cancer will die from cachexia with a bit of tumour about that size. Somebody with breast cancer can have cancer in many, many areas of the body, loads of tumours, and they won't have a bit of cachexia. So, you know, we really need to start to take things a lot more seriously. So, what we move on to is what becomes much more of a valued, balanced approach, where the chemical assault on the body becomes less, the support for the body becomes much increased, and importantly, and I haven't mentioned so far yet, but obviously the psychological, spiritual elements that make up that needs terrific support and help, because we can't just go on dealing with cancer in a biochemical fashion. It's all about the person. And some of the people I see, I talk to a lot of other practitioners, and I think there's one thing we're all agreed. A lot of these things that we hear about, these are tools that a person can use, but the most important thing is the person themselves. The person needs to be enabled to bring those things together and to become their own healers. Because psychologically and spiritually and emotionally, those elements are as important as eating broccoli or having chemotherapy or anything else. And unfortunately, the way we've developed cancer care at the moment is we've annihilated those things, we've sidelined them altogether. And in fact, sometimes because of the effects of chemotherapies and what have you, we actually put people in a straitjacket where they're not able to use those healing facilities that the body may be in. So again, we have the argument, perhaps, less toxic doses, less toxic treatments would actually, are we so scared of going there that we can't see that this may actually open us up to much, much better things? So then we have our people looking at, what's the evidence base, toxic, non-toxic, compliance. Compliance is a great thing. We've developed a very, very scary orthodox method of dealing with cancer. And I see people being scared into having treatment that they don't want every day of the week. And that's a great shame, perhaps. And we can educate our doctors that they can actually offer people a great deal more, then they won't feel that they have to bully people into having toxic treatments. So it is about the whole person. The body's designed to heal. Give it the right support, the right environment will do so. And that is why some people survive cancer and some people do not. I was talking to my husband about this a short time ago. And I don't think he listens to me very much at all, actually. He switches off. Don't blame him. Been married a long time, you know how it is. But he suddenly pipes up and he said, it's the Star Trek thing, isn't it? Hello? What? He says, Star Trek. He says that Star Trek film where Bones comes back from the future and goes around the hospital, and he's looking at everyone having the treatment and the chemotherapy, and he's going, "Oh my God, Jim, they're not still doing that, are they?" And I'd like to think that in the future we can look back at this time now, and I hope it's not too long before we can sort of say, thank God, the research was done, the right investment was made in the right ways of doing things. Doctors opened their minds and realised that actually a more balanced, integrative approach is actually going to increase people's quality of life. It's very, very possibly going to save money. And I would bet if you actually evaluated the whole process, the whole programs that people can go through, we would actually get better results. If somebody would give us the facilities, the money, and some of the massive, massive research money that gets spent by Cancer Research UK, a small percentage of that would even start to give us the evidence that we need. So I would say to anybody with cancer to take good notice of my husband and go boldly into the future, because that's what integrative medicine is all about. Thank you.